Good afternoon, everyone, and welcome to the Board of Health meeting, special meeting, January 6, 2022. Please note that this meeting is being recorded and will be available shortly hereafter for scheduled and on-demand viewing on any smartphone or tablet device. If anyone else is recording the meeting, please notify the chairman. Pursuant to Governor Baker's June 16th, 2021 signing of an act relative to extending certain COVID-19 measures adopted during the state of emergency, including the extension of his March 12, 2020 order suspending certain provisions of the open meeting law, general law, Chapter 30A, Section 20, until April 1st, 2022, this meeting of the Chatham Board of Health is being conducted in person and via remote for public participation. Every effort will be made to ensure that the public can adequately access the proceedings as provided for in the order. A reminder that persons who would like to listen to this meeting while in progress may do so by calling the phone number 508-945-4410, and the conference ID number is 432-098-110#. Or you may join the meeting online via Microsoft Teams through the link in the posted agenda. While this is a live broadcast and simulcast on Channel 18, despite our best efforts, we may not be able to provide for real-time access. We will post a record of this meeting on the town's website as soon as possible. And I'll turn the meeting over to Chairman Beckley.
Thank you, Judy. It shall be the policy of this board to conduct its meetings under the open meeting law so as to encourage public participation whenever time permits and as part of the agenda item discussions. I'd like to first establish the fact that we do have a quorum on the call today. When I call your name, please indicate whether you're present. Dr. Noble Hanson?
Present.
Ron Broman? Ed Sheehan?
Ed Sheehan.
Carol Boyce?
Present.
I'm here. And Dr. Richard Edwards?
Present.
Okay, we have our quorum. We have a short agenda today, so let's get right to it. Item 1 is a discussion and a vote on the town-wide mask wearing mandate. We all should have gotten a copy of a draft order sent to us by Dr. Duncanson. Dr. Duncanson, you want to introduce this?
Sure. Thank you, Mr. Chairman. At the board's meeting on Monday, staff had presented a proposal to you for a mask mandate that would have applied to town buildings only in response to the upswing in COVID-19 cases caused by the Omicron variant. During that discussion, the board expressed interest in broadening that mandate to include basically any establishment in the town of Chatham. So we went back and revised the proposed order, and that's what was distributed earlier, is up on the website as part of the meeting posting and is being discussed today. And basically, this new mandate would require the wearing of masks at any indoors at any establishment in the community, being business, club, place of assembly, including but not limited to retail establishments, offices, restaurants, bars, performance venues, social clubs, event spaces, places of worship, places of religious worship, libraries, and municipal buildings. Food service customers would be allowed to remove their masks when seated. Lodging workers and guests would be required to wear masks when inside hallways or common areas. And the only exception to this indoor mask requirement would be for a single individual in a private office space. In addition, masks would be required for any business or conduct of personal services such as hair salons or massage parlors. And then masking, we just reiterated the fact that masks are still required under the governor's, under the state's order for all modes of public and private transportation. This order, for clarity, the order would not apply to private gatherings in private residences where there's no monetary compensation for use of the premises. And it would not apply to unorganized gatherings in unenclosed outdoor spaces such as parks, athletic fields, or parking lots. The order goes on to indicate that the board strongly recommends the use of an N95, a KN95, or a multi-layer surgical mask in lieu of basically single-layer cloth masks based on recent data that indicates the Omicron variant is much more easily spread, and cloth masks are less effective at preventing that spread. It does provide that this order would not apply to individuals under 2 years of age or any individual who is trouble breathing, is unconscious, incapacitated, or unable to remove the mask on their own, or anyone due to a disability or medical condition that is unable to wear a mask. It goes on to indicate that the board strongly believes in the importance of vaccination, and then provides for a penalty if someone is not in compliance and we receive such a complaint. As presented right now, the emergency order would go into effect tomorrow, and it does not have an expiration date. So that's what our order currently is designed to address. And if you'll bear with me a second, the City of Beverly Board of Health last night imposed a mask mandate that they had talked about previously. The first public session was not well handled, but they did discuss it again last night and subsequently voted to adopt it. It pretty much mirrors everything that we had in ours, although there is some more specificity that I want to bring to the board's attention for your consideration. In terms of food service establishments, their regulation says food service establishment customers may only remove face coverings when seated and actively consuming food and or beverages. So that's a little bit more clear, if you will, maybe, than ours. For indoor bar and dance customers may only remove face coverings when seated at tables or seated at a bar, again, actively consuming food or beverages. Patrons standing or ordering at the bar must be masked, and patrons on dance floors must be masked. Let's see. Indoor performance venues, we really don't have. Lodgings, we don't have. They also have a paragraph or an item about residents or employees of multifamily dwelling units. We only refer to lodging establishments. So they go on to say residents and foods and employees of multifamily dwellings are required to wear face coverings inside hallways and other common areas. And that building management shall post a notice of this requirement at all entry doors to the buildings and common areas. They talk about fitness club and health club, personal service. I think they do have a little clarification on the personal service establishments, including but limited to barbershops, hair and nail salons, and massage bodywork establishments. They go on to indicate they do have an exemption for skin or beard care that occurs on the face, where customers may temporarily remove the face covering, but immediately must put the face covering back on for the remainder of the visit. And then the other significant thing that Beverly has in theirs, which I know the board did talk about Monday, they have a sunset clause in their order. Their order was effective at 12:01 a.m. today, and it indicates it shall remain in effect until 11:59 p.m. on February 2nd. So I just wanted to bring those things to the board's attention for your consideration, knowing that, some of those things had been briefly discussed or raised at the board's meeting on Monday. And with that, I'm happy to answer any questions.
Members, comment?
Noble? Noble? Can you hear me?
Yes, Noble, go on.
Yes.
Oh, yeah. In that paragraph, mask or face covering shall be worn. And then in that first paragraph, when it says food service establishment customers may only remove mask face coverings when seated. We could simply add, and I think it was before, seated and eating. Didn't we have seated and eating before?
I don't recall if that's what they had before. I
But
would
we could add that.
suggest,
That would cover all that business about, actively eating and all that.
yeah, I would suggest we use the language that's similar to what's in Beverly's, which is actively in the actual act of eating and drinking.
Okay. And then I had on the second page in the second paragraph, that sentence, we encourage all eligible persons who are not fully vaccinated, comma, and boosted if eligible, comma, to get immunized. Why don't we just say, we encourage all eligible persons to get vaccinated and boosted?
We could
Minor
certainly
thing.
say that.
I
Sure.
mean, the other one was kind of, I don't know about the punctuation exactly, but.
In that same sentence, I would prefer the word vital to be put in where it says important. Full vaccination against COVID-19 remains vital to reduce hospitalization and morbidity from the virus. I don't know what anybody else thinks. It just, or
You mean in substitute important with vital?
or vitally important or whatever. I just want to
Yeah,
stress
vitally important
that.
is fine. That sounds good. Emphasizes.
I just want to emphasize the vaccination remains. How about vitally important?
Okay, so what it would say is full vaccination against COVID-19 remains vitally important to reduce hospitalization and morbidity from the virus.
Yep.
And then the second section would read, we encourage all eligible persons to get vaccinated and boosted, period. And take out
Fully
if
vaccinated.
eligible to get immunized, correct?
That's good.
Yes.
So end it after boosted, okay.
I know when we were discussing this order on Monday that we did talk about a sunset clause. And I spoke in favor of that at the time because I wanted to signal to our community that we wanted to be mindful of the importance to take it away when appropriate. So I like what Beverly included, which was a sunset clause to end, and I don't know about February 2nd, but I wanted the time with when we had after our final meeting in January. I'm not sure of the date of that. What do other board members think about putting a sunset clause in our order? Or do you prefer to just have it be open-ended?
This is Richard. A couple of things. I think it's extraordinarily unlikely that by the end of January we're going to be at the point where we can stop this. And if we're going to put in a sunset clause, I think it needs to be longer out than 3.5 weeks from now.
Yeah.
I'm concerned that if you put a sunset clause in, well, then people are going to be planning on stopping it, and then you'll probably, unless the sunset clause is out in the middle of February or later, it's highly unlikely that we'd be able to discontinue these orders that quickly. Now, this is unlike me, but I'm a little concerned about the language about actively eating, because that's very nebulous. What does that mean? So that means that if somebody goes into a restaurant and they order a meal, then they put their mask on, and then when the hors d'oeuvre comes, they take their mask off, and then they put their mask back on until the entree comes, and then put it back. And then after, when people are sitting at a table in a restaurant eating, putting masks on, taking them off, putting them on, taking them off is going to be difficult to enforce. And I would much rather see the rule about sitting and excluding, walking along, standing up in the bar and drinking. And I think that the best thing would be if we could have some mandate regarding social distancing. And if you're sitting at a table, the tables need to be an adequate distance apart. That's the way it was all run back in the beginning of the pandemic, that restaurants had limited amount of seating, and that's what could keep people apart and make things safer. But I think that the term actively eating, requires a lot of interpretation. So unless you want to make the mandate very long and complex and identify what you mean by actively eating and actively drinking, I wouldn't be in favor of that.
What do other board members think?
Ed
Noble?
Sheehan, I'm in the favor of that.
Well, I understand what Dick's saying. My recollection was it was sitting and eating. Didn't we use that kind of a phrase before, sitting and eating? And maybe active eating, you could just say and eating, and it would be more general and not nitpicking, of what people can and can't do.
So if you're sitting at a table in a bar and just order beers, that wouldn't
Eating or drinking, I
then
think.
you wouldn't. Then you.
I think it was eating and drinking. Eating or
Well,
drinking.
that's pretty much. What else would you be sitting in a bar or a restaurant for?
Well, what's the language you want, Dick?
I thought it was fine just saying that the customers need to wear masks except when they're seated at the bar or the table, and the bars and restaurants need to have a provision for social distancing. So at a bar,
I don't disagree with that. That's a little more lax. I mean, I don't think we should go overboard with these things. We have to make it serviceable. That's why the social distancing 6 feet. I think then we're asking restaurants maybe to reconfigure their booths and their tables, and I think that's just a bit too much. I think we should just go with wearing the mask, personally.
Well, at a bar, they used to have an empty stool, an empty space between every two customers, or between each party. They're not really doing that anymore, but they should. Because even if you're sitting at a bar and you're taking your mask on when actively drinking, when your mask is off, if you're sitting at a bar and you're 6 inches or 10 inches from the person next to you, that's a dangerous situation if they're not in your party.
I don't know who else has an opinion, wants to comment. These are not easy.
Well, I'd like to see us add about if you're standing at a bar that you must be masked. And I agree with sitting and eating or sitting and drinking and get rid of the word actively.
Okay, that's fine. I don't have a problem with that.
I think it's clear what the intent is, sitting and eating or drinking.
Yeah, I agree with that.
Yeah, I think I agree with Noble. I'm not sure I want to wander into that 6 foot distance again for all of these settings. It may make sense scientifically, but I'm not sure we want to go down that path.
John, this is Judy.
Yeah.
I'm sorry, I just wanted to weigh in and just remind you that the last time that we had the distancing, the social distancing in restaurants, that was all state ordered. That came down from DPH and the governor's office, and it was much more, something that every town was doing. It was something that everybody recognized. I think that would be a tough thing for us to wade into, as you said, at this point. I think the masking is a good start right now. Just something to think about.
Yep.
Yeah, it's really very difficult because when you think of it, if you think of 30 people sitting at the bar at the Squire with every stool occupied, drinking, that's a highly dangerous situation. And we say you should wear a mask when inside, but if we say, well, it's fine to have people shoulder to shoulder at the bar not wearing a mask as long as they ordered a drink, then we're going to be closing down the restaurant frequently. There's going to be just a lot of transmission with Omicron.
John, I don't know, I'm hoping you can see it. I'm just sharing my screen. I just pulled up the Beverly mandate, just so you can see their specific language. And I don't know if you can see my cursor, but number 3 is the one that they have that deals with bars and dance customers, which says indoor bar and dance customers may only remove face coverings when seated at tables or seated at a bar and actively consuming food and or beverages. Patrons standing or ordering at the bar must be masked. And then patrons on dance floors must be masked.
Well,
I guess the question is, how is it safer to be sitting at the bar shoulder to shoulder without a mask than standing ordering without a mask? It just seems hard to understand how it's going to be safe to have people sitting at a crowded bar without masks, but without any consideration of leaving some space between people at the bar.
And they're probably, Dick, they're probably talking about people who are going up to the bar to order a drink and they have to lean over and talk to the bartender and get pretty close to the patron at the bar. Maybe they're talking about that. I personally thought that the Beverly wording was good, except for maybe removing the word actively in light of some good points that Dick made earlier. You can only do so much. I mean, people that go to a bar during an Omicron surge should know what they're doing. It's their choice to go there, and they should be careful.
Yes, no,
Right,
but I agree with what John said.
We're telling people it's okay to go sit at the bar and not wear a mask.
Yeah, I agree with what John said. I think that we don't want to get in the situation where we're asking them to reconfigure and all that right now. And I think that, to Dick's point, this isn't perfect. This is a step up. You can always find loopholes. If you have 8 people sitting at a table shoulder to shoulder, how is that different than 8 people sitting at the bar shoulder to shoulder? I mean, there's all kinds of loopholes and things you can point to. So it's not like you're going to have a double-blind study on how people should be seated. We just make we make a rule as best we can. That's simple, that people are likely to follow.
That's true, but of course, the 8 people sitting at a table are in a group. They know one another. It's not strangers. But I know it's difficult.
What about the sunset clause? We didn't really arrive at a consensus on that. I thought Dick made a good point that it would be highly unlikely that we would be through an Omicron surge as soon as 3 or 4 weeks from now. Although I like the idea of a sunset because it does show some good faith on the part of the board in wanting to lift a new requirement as soon as we practically can. I don't know. I could go either way with this. We could keep it open-ended, or we could have a sunset, but further down. Could do a
Well, we
60
can always
days.
stop it.
Unmute Ron.
Hmm?
Ron's trying to speak.
Ron,
His microphone's turned off.
Ron, you gotta unmic, you gotta unmute yourself. Can you hear us, Ron?
If you're on the phone, Ron, it's *6.
No, his picture's here.
Oh, it is?
Well, let me just say while Ron's getting on, I like John's idea of indicating that, you know, it is going to be temporary. We're looking as to when we can lift the order. I like that for the public. It looks to me like in February 7th would be our first meeting in February, and we could just say something that the policy will be revisited on February 7th, just indicating that we have an open mind, depending on the numbers. And I think that shows good faith to the public.
So that would mean that we would word the order without the sunset. However, we would add a sentence in this current order committing the board to revisiting the policy after, you know,
At our first meeting in February, which is the 7th, I think.
on our first meeting. I like that. It's kind of a
First meeting in
compromise. I like
February, and that gives a good period of time. It shows that we're going to revisit the policy and we'll lift it when we can. And I think that's how we should do orders in a way. Like
Well,
that.
other board members okay with that?
I agree. I agree with Noble that to leave it open-ended and we'll just revisit it
Okay,
in February.
okay. Ron, you okay with that?
Yeah, I think if we bring it up at our meetings and just say we want to, it's time to drop it or what, wait and see what happens. None of us
Okay.
really know what's going to go on.
I know.
It's
Richard,
Ian, I agree too.
Richard, you okay with that?
Yes, no, I think that would be a good solution, because we will be discussing this at each meeting, I'm sure.
I think we will, but we'll build in a sentence, a statement in this order that commits the board to revisiting the status of the order at our first February meeting.
Okay, so just so I have it clear, we would amend the last sentence in the order to say this emergency order shall be effective, and I was going to put in at 12:01 a.m. January 7th, 2022, and shall remain in effect until notice is given that the Board of Health judgment within order is no longer necessary. And then add a new sentence that says, board will revisit this order. Sorry, I'm just writing on the fly. At their meeting on February 7th. Is that
Good.
the direction you want to go in?
Yes.
Okay. So it would read, this emergency order shall be effective at 12:01 a.m. January 7th, 2022, and shall remain in effect until notice is given that in the Board of Health judgment, the within order is no longer necessary. The new sentence would then read, the board will revisit this order at their meeting on February 7th, 2022.
Good.
Okay, and obviously the way that first sentence is worded, if by chance something happens before then, the board could certainly reconsider it earlier if you
Yes.
wanted to.
Right.
Yeah, okay.
Yes.
All right.
And then, did we agree on the wording regarding seating and eating, that we're going to go with the Beverly wording?
I like what Beverly had there, number 3.
And then remove the word actively?
Right.
Okay, so we would revise, and what I'm going to do is where we have only 3 bullets, basically the second paragraph, where it says mask or face coverings shall be worn, colon, and then there's 3 bullets under that. I'm going to expand those bullets to kind of break them out individually, if you will. I think it just makes it clearer. So the first one would be the general one. The second one would read, food service establishment customers may only remove mask/face coverings when seated and consuming food and or beverages.
Good.
That's what you want? Okay. And then seeing what the board's talking about, I get the sense you want to add in number 3 from the Beverly one, which provides a little bit more specificity on the bar situation. So we would do indoor bar and dance customers may only remove face coverings when seated at tables or seated at a bar consuming food and or beverages. Patrons standing or ordering at the bar must be masked, and patrons on dance floors must be masked. Is that the direction you want?
I like it. What do other members think?
I like it.
I think that's fine.
I also
I
want to
like
get,
it.
I want to get away from the bar patron holding a beer and walking around the bar visiting with all these other people while he's unmasked.
Okay, well, that would be covered with the first part, because if you're in a bar, you can only remove your mask when seated at a table or seated at the bar.
Precisely. Exactly.
Right.
Do you want me to add in number 6 relative to the multifamily dwellings? Because we do have a number of those in Chatham. We do call out lodging workers and guests, but we do not, we're silent on multifamily dwellings. And I do know that that was a question that came up, last year when we had the mask order. So I think it would be prudent to add that one in there, just again, for clarity, so that, hopefully it alleviates questions.
Yep.
This would be like an apartment complex that has hallways.
Yeah, or even say a 2-family dwelling with a common hallway or something like that, yeah.
All right, I think we should.
Okay,
Everybody okay with that?
Yes.
Yep.
Ed
Yeah,
Shane.
I agree.
okay, and then on personal services, I think it would be helpful to clarify that barbershops are included in there, because that's not spelled out in ours. And do you want to go with that exemption regarding skin or beard care? Somebody can temporarily remove their mask and, get that treatment and then has to put it back on again. Again, I think it's just more clarity than anything else for people.
I'm okay with that.
Yeah,
Okay.
That's fine.
And I think there really wasn't anything else out of the Beverly one that, I think needs clarification. Do you want, one thing I did notice, do you want this, does the board want this applied to the schools as well? Right now, we just say municipal buildings. The Beverly one does say municipal buildings, including schools.
Don't schools have their own detailed protocols that they have to adhere to?
They do, and I believe that the schools are required to mask up under the DESI guidelines. Yes.
I would defer their guidelines to their own.
Okay.
I agree with that, because I don't even know what their mask rules are there or not.
Yes.
Yep.
I would defer to their best judgment.
Okay. All righty. Then if you'd like, I will run through this quickly with all the changes you've made, just so everybody is clear. And then, John, I assume you want to see if there's any public comment on this.
Okay,
So we would expand upon the food service establishment so that now reads, food service establishment customers may only remove mask/face coverings when seated and consuming food and/or beverages. We would add in indoor bar and dance customers may only remove face coverings when seated at tables or seated at a bar and consuming food and/or beverages. Patrons standing or ordering at the bar must be masked. Patrons on dance floors must be masked. Let's see. We would modify, let's see, personal services, including hair salons, barber shops, and massage bodywork establishments. Customers and workers shall wear face coverings, comma, except for skin or beard care that occurs on the face where the customer may temporarily remove the face covering, but must immediately put the face covering back on for the remainder of the visit.
good.
Okay?
Yep.
And we would add in residents and employees of multifamily dwelling units are required to wear face coverings inside hallways and other common areas. Building management shall post notice of this requirement at all entry doors to the building and common areas.
Good.
Okay?
Yep.
And then in the first full paragraph on page 2, full vaccination against COVID-19 remains vitally important to reduce hospitalization and morbidity from the virus. We encourage all eligible persons to get vaccinated and boosted, period. And then the highlighted or the bolded section regarding the duration would now say this emergency order shall be effective at 12:01 a.m. January 7th, 2022, and shall remain in effect until notice is given that in the Board of Health's judgment, the within order is no longer necessary. The board will revisit this order at their meeting on February 7th, 2022. And that's all the changes that I have.
I think that covers it.
Yeah, and then Bob, will you still be able to get this out tomorrow? I mean,
We will-
we'll vote on the changes and then you can get it out as an order tomorrow?
If
Okay.
you vote on it now, we will get it out by end of day today.
Okay.
Okay, before we vote, let's ask if there's any public on the call that would like to comment. Okay, I guess.
Can I ask, how does this get distributed to the businesses?
Yes, good afternoon, board. I'd like to make a comment.
Okay, sure. State your name, please.
Yeah, Niles Draper, South Chatham. I'm curious as to what legal authority the board is claiming to go into people's houses, into private businesses right now, and impose more penalties upon them and certain restrictions. There's no emergency order act in Massachusetts. Just because other towns and especially Boston are doing this does not mean they have the authority to do so from the Board of Health. And I'm just curious of what statutes you're claiming to have the authority to go into private businesses and private houses and impose mask mandates.
Well, let me comment first because this order does not apply to private houses.
Well, multifamily, sir.
They are multifamily. They would not be considered private residences.
Okay. I don't know how that shapes up, but fine, let's stick to bars and restaurants.
The board is citing their authority under Mass General Law, Chapter 111, Sections 31 and 122, 310 CMR 11.05, 105 CMR 300.200.
Sure. And thank you for pointing those out. And as I've reviewed those in the past, I know these are very broad rules and very broad areas that you can make interpretations. I personally am challenging that, but I understand if you want to continue down this road. I just think the board is missing a significant opportunity to inform the public and let the public know that it's really under their own due diligence to go into these places during pandemic. We patronize these certain places. Quite frankly, listening to some of the details that I've heard on here about how we're going to stop the spread by people sitting at groups of tables of 8 or bustling up to bars and stuff like that. I don't think the board has really taken the time to look at the new data, how things are spreading, the threat of Omicron. You're really penalizing
Somebody challenging.
people for
the
going
board.
out and trying to live their lives. I'm sorry?
I can come
Sorry, Judy?
Yeah, let me talk to you after or whatever. Okay.
Okay. I just think it's an opportunity for the board to say, just because other towns are doing these actions, they're not going to make a marketable difference. I don't think that anyone sat down and looked at the data from Boston or from Somerville and has analyzed the fact that they've had mask mandates now for over a month and their numbers are still increasing like anybody else's. You're not going to make a difference here. It's just a matter of telling people to live their own lives and to live lives responsibly and take care of their own actions. And that's just my comment. I don't know why we need to go in there and think that we're going to make rules that are going to change this. That the board has an opportunity to step back and say, we're not going to get into that business because we're not going to make a difference. We're just making rules right now to make people feel safe, where in fact, the only way they can be safe is to take, responsibility of their own lives. And that's my comment. Thank you.
Okay, thank you. All right, can I get a motion on the,
There's one hand up, John. I'm sorry. Nicole Stern.
okay, pardon me. Nicole?
Yes, and yes, can you hear me?
Yeah.
Okay, great. I wasn't tuned in at the beginning of the meeting, so I didn't hear everything that Dr. Bob had to say, but I just wondered the latest data that's come out specifically talks about that unless you're wearing an N95 or a KN95, that the others really aren't doing anything to protect you, which I assume means they're not protecting people around you either. I've seen a lot of people, in different establishments, and they're wearing BJ masks or cloth masks that we all were encouraged to use a year ago, but the data says they know that they won't protect you. So again, that was my question. Maybe it's already been covered. I'm not sure. Dr. Bob, are you still there?
Yes, I'm still here, and I think that's why the board included language in the order strongly recommending the use of N95, KN95s, or multi-layer surgical masks. They did discuss that issue at their meeting Monday and wanted that language added into the order to address that issue.
Okay, well, thank you. I did miss that, but however, I guess this isn't something that you have to do. You're doing the best that you can, but there will be people sitting at the bar. There will be people sitting at a table of 6 or 8, and they will be wearing masks, but they're not going to be the kind of masks that are going to do any good. So, which is unfortunate, but I just wanted to make sure that we were all aware of that.
Yeah.
Thank you very much.
Thank you, Nicole, for your input.
You're welcome.
Any other commenters?
I don't see any, John.
All right. I would suggest that the board proceed. And if so, can I get a motion to approve the draft order?
Motion to approve, Ed Sheehan.
I'll second it.
Second,
John?
Carol George. Yes?
I would just suggest that you approve the draft order as amended.
Right.
Okay. You okay,
Approved as
Ed?
amended.
As amended.
And I'll second it.
And we have a second. When I call your name, please indicate how you vote on a motion that's been seconded. Dr. Noble Hanson,
Approve?
Ron Broman. Ron Broman. Hit your button. Hit your button. Can't hear you, Ron. You still-
Ron, give a thumbs up.
Thumbs up. Okay, we'll take that. Ed Sheehan? Yes? Ed, we're voting on the motion. Do you approve? Or how do you vote? Do you approve on the motion?
Ed Sheehan, approve.
Carol Boyce?
Approve.
I approve. Dr. Richard Edwards?
Approve.
Okay, so the order has been approved. Item 2, recommendation requirement to return to all virtual meetings for town boards, committees, and commissions. Bob, how would you like to proceed with this?
Well, this topic has come up over the last couple of days in conversations with the town manager. As you probably know, town boards had started again last fall meeting in person, as your board did. Now with the rise of the Omicron variant, even in-person meetings, you do have a requirement for everyone to be masked in the town meeting rooms. But as you know, with the widespread Omicron variant increasing, there has been some discussion as to whether or not the town should pivot back from having in-person meetings to a virtual-only platform. And so the town administration was looking for the board's input on that topic as to whether or not you feel that's the appropriate thing to do now for some period of time or not.
All right, so they're looking for a recommendation one way or the other.
Yes, or you could even go stronger than that and order it. But I think at least a recommendation is what they're looking for at this point.
All right, I'll open that to discussion by board members. What do people think?
Yes, Noble. I think last time, the actual order to go to virtual was by the town. So
Yes.
I don't see us making that order, but I would be in favor of making the recommendation that they consider, or the recommendation to go to virtual meetings for the boards, and then each one can, make their own decision, or the town can do it.
Yeah, I recalled the same thing. This was not a decision we made, but it was we're being asked for
And
what
I don't think I feel comfortable telling the select board that they have to meet virtually. I think that's something that comes from them, but we can make the recommendation.
Richard, what do you think?
I agree. I would make the recommendation.
Ron? Thumbs up? All right, Ron says thumbs up. Carol?
Thumbs up.
Ed?
Yes.
Okay, I agree. So Bob, you have your recommendation from the Board of Health.
Let me
Is that-
just comment that it could depend a lot on the individual board. A board that only had 3 or 4 people that
Right.
had plenty of space to social distance and felt that direct confrontation between people is more effective, could make the decision to meet in person. And even the Board of Health, we could conceivably meet in person. We have a lot of space. But I think each board should make that decision.
I agree. And then, and I would ask Bob, is that what the town's looking for? That kind of a recommendation? Is that adequate in your mind?
I think your recommendation that the town consider moving back to a virtual only platform. And then obviously the town can decide how they want to implement that, or if they want to allow any flexibility, if you will.
Yeah, and that works, you think?
Okay.
I'm good with that. I think that's pretty clear. Do we vote on that, Dr. Duncanson, or just take it as a recommendation?
You can certainly vote on it. Obviously, that would give it a little bit more weight, if you will.
Okay. Can I get a motion?
Motion, Ed Sheehan.
Okay, we got to get a second and some wording here.
Noble, I'll second it, and that we make the motion that the town, we recommend the town consider going to virtual meetings. Do we need more than that?
I think that's good enough. Ed, you okay with the wording of that, Ed, right?
Anything else, Bob, that we need to be, that gives them freedom to do how they want, I think.
Yeah, no, I think that's fine.
Okay, we have a second and a motion, and when I call your name, please indicate how you vote on that recommendation. Dr. Hanson,
Approve?
Ron Broman,
Approve?
Ed Sheehan,
Approve.
Carol Boyce.
Approve.
I vote to approve, and Dr. Richard Edwards.
Approve.
Okay, we're down to item 3, a revision to current mask mandate for meetings in town facilities, adopted by Bob. Do we have to? What does this one cover that the other ones didn't?
This one becomes somewhat moot, obviously, if the town does move back to virtual meetings. But
Okay.
it was just whether or not the board wanted to consider any changes to that at the present time.
Okay. Well, I think the current mask mandate for meetings in towns and facilities is fine as it is.
Okay.
Yeah, I
We
agree.
will just continue that. That will remain in effect regardless of anything else. Okay.
All right, that's it for the agenda. Anybody else have anything they want to raise before we adjourn?
Yeah, oh, Noble, just quick. Everything for the next meeting, but on the McGrath thing, are we on schedule to get a warrant article or a placeholder article for mid-January before our next meeting? Are we timing wise, are we okay there?
Yeah, we'll be working on that shortly.
Okay. Great, thank you.
All right, can I have a motion to adjourn?
I'll make the motion to adjourn.
Can I get a second?
Ed
Second.
Sheehan, adjourn.
Okay, when I call your name, please indicate how you vote on the motion to adjourn. Dr. Noble Hanson,
Approve?
Ron Broman,
Approve?
Ed Sheehan,
Approve.
Carol Boyce,
Approve.
I approve, and Dr. Richard Edwards.
Approve.
All right, ladies and gentlemen, thank you. Our meeting's over for tonight. Bye-bye.
You got it, Dallas. Thank you.